Okay, people have been asking me about the virus. I want to present stuff that is research oriented. This is not a medical advice, but it's only research. Okay, so to discuss with your physician before you do anything. Number one is the most important thing for the COVID virus is prevention. You need to make sure that your hands are clean. Most people use detergents or whatever, or antibiotic sources of soaps. No, alcohol is the best, okay? Make sure that you wipe the doors, the doorknobs, when you go into a patient or a facility where you touch a lot of patients. Make sure you clean that, go in. Make sure that when you drive, clean the wheel drive, okay? Most people, when you go to the supermarket now, it's kind of funny that we're telling me there's no food. So I go to the supermarket thinking, oh my God, there's no food, let me go check it out. And the meats are there, the vegetables are there, but then I go to the aisle of cereal, none. I go to the cookie aisle, none. The bread aisle, gone. And the chips, gone. So I think we're gonna have more diseases, more people having issues, obesity. We're gonna have an increase of diabetes because the stress and the amount of sugar they're eating. So, no, sugars are no. Now note that research do show when you're in a ventilation, in a ventilatory or intubated, that a higher fat content and a lower carbohydrate content helps you get out of that stage or that, I would say, severe condition much sooner. And they have done this by giving those patients EPA, okay, and GLA. And actually, it's one of the few times that I'm going to say alpha omega-3 might help you preventing inflammation of your lungs. Now, I want to say this, absence of disease doesn't mean that you're healthy. Most people don't know they're sick, and in the population that we have now, a lot of people are obese. About 42% of the population are obese, based on BMI, of course. If it's real obesity, I would have to say 60%. But absence of the disease, meaning that you have no condition, I say, oh, I'm healthy, doesn't mean you are healthy. Okay, you don't have no diseases. You might have nutrition issues, you might be obese, you might have all these conditions that will allow you to get the disease much faster. One of them is vaping. Okay, most people say vaping is benign, smoking is benign. No, what does vaping does affect your lungs, what does smoking does affect your lungs, which give you a higher probability of a chance of getting worsening of this virus. Now, I want to show research. There's a paper that included 7 people that had the virus that were getting worse, and they were given immunoglobulins, IG. And these people recovered much faster, quicker, without any adverse events, and they were able to go home sooner and get out of the ventilation by using IV. It has to be done in a hospital, but I just want to let you know that's the way. One thing is that we're talking about Citromax or Z-Pack and chloroquine. I have seen patients in my office, and that's what I have used, is Z-Pack and chloroquine. Those patients are fine. They were sick, but they're fine now. So be aware of that. Treatment, yes, I've been proven that helps. Now, when I do that, I use zinc 50 milligrams when I give in the Citromax and the chloroquine. The reason I give in zinc is because zinc has shown for some reason to do something to block the receptor, and I have the research, but something happens when you give zinc. Now I have melatonin, zinc, vitamin D, vitamin A, vitamin C, and selenium. And selenium have a little star there because there's no research done against COVID virus. So it's a hypothesis, but selenium helps your immune system, okay? So be aware of that. Now, melatonin has shown, research already shown that actually helps you with the coronavirus, prevention and possible treatment. So you need between 3 and 6 milligrams, okay? Zinc, 50 milligrams, everybody should have that. Vitamin D, you need higher dosages than normal. Most people are deficient in vitamin D. There's a couple of papers stating that the deficiency can induce more or give a body that is more susceptible to get coronavirus. For example, European people are very low on vitamin D, especially Italy, so they might be low. I highly recommend between 20 to 50,000 I use a day. I take 20,000 daily, okay? Vitamin A. People do not discuss vitamin A, and there's no research right now of vitamin A against the COVID virus. Pretty soon there will be. But vitamin A is an antiviral at the right amount of dosages. Now vitamin A is told that it's toxic, which I don't know if I've never seen one yet, and I use very high dosages for a short amount of time, for 7 to 14 days. My dosages are 100,000 to 150,000 I use of vitamin A combined with the vitamin D, and then I stop them. Or I reduce the dosages to 5,000 I use, or 10,000 I use of vitamin D and A. And the last one is vitamin C. Absolutely, there's research, concrete research, that it helps people that are sick. IV, you do not need 1 gram, you don't need 3 grams, you need 6 grams or more, up to 25 and 50 grams if you're that sick in the ICU. I take 6 to 10 grams every day. Why? Because I want to prevent the virus. I have to deal with patients, so be aware of this. Now, research is behind this, research is behind it, research is behind this, research is behind this, some research is behind this. There's no research against the COVID virus. Yes, there's research. Selenium is the sideman that I think it will help with this, but I'm not sure about it. So I just want to tell you things that will kind of help you. Be aware that, again, this is not medical advice. This is just research-oriented suggestions. So be aware that you need to make changes. If you're eating poorly, start eating better. If you're obese, this is the time. You're home. Start exercising, walk on your place, and start doing a home program with lifting your own body. Infinity Fitness has a bunch of exercise that you can do if you don't have weights, okay? So be aware of that. I hope that this helps you guys. I'm praying for everybody. This is a time of severe distress and stress, which will elevate your sugars, okay? Be aware of that. Please take care of everybody. Make sure that you guys follow the rules. I'm sure that President Trump will be giving new orders or making some statements. Follow those also. And if you have any questions, please direct them to Scott. Thank you.